Do the participant. Oh, I can do that. Sorry, this is the first 5 minutes of every meeting. All right, so we do have 2 participants. Can we go right to them?
Good evening.
Yeah.
Good evening. I would like to call the Social Service Committee to order. Jessica, can you please call the roll?
Sure. Chair O'Fry,
Here.
Vice Chair Ngola,
Here.
Councilmember Burns,
Here.
Sherry Lackey, here, and Ken Rowling.
Here.
Right, a quorum is present. We will begin. We have a period for public comment, as is usual, at the beginning of our committee meeting. Do we have any written comments filed? Public comments filed? No. Anybody in the audience? All right. Oh, Tina. Come on. Generally up.
Hi, good evening. I'm Tina Payton. Some of you know me in the room. I provide affordable housing in Evanston for over 50 years. I think Katie,
Yeah, we just spoke.
we did a
Yeah.
Zoom last
Yeah.
month, and so actually
Good
you're
to
the
see you.
reason why I came to this meeting today.
Yeah.
It's very hard for someone like me, to continue to provide affordable units without support. I've never been given any grants or housing or anything. And when we take affordable units, of course, we're taking much less than what the average is. We know here in Evanston, there's a lot of luxury living, and so it's difficult. I hope to continue to provide affordable units in Evanston. I've worked with a lot of programs over the years, Connections, Center of Concern, Catholic Charities, Trilogy, the list goes on. But I would hope that this committee, as well as agencies and the city and everyone, could get behind someone like me. There's very few landlords like myself. A lot of people don't take vouchers, or their rent is higher than the voucher. So I would hope to continue, because that was my family's vision, to help people. And we always talk about how we have no affordable units, or we don't have this. You do, I'm invisible when it comes to assisting me. So you have to help me so I can help everyone else. Thank you.
Thank you. All right, any further public comment? Thank you for coming and for your comments. I really appreciate them and learning more. The first, or second official item we have is the approval of the meeting minutes from April 11th, which are attached. Do I have a motion for approval?
So moved.
Perfect, and I have a second from Ken. And we can do a voice vote. All in favor of approving the April meeting minutes? Say aye.
Aye.
Opposed? All right, the ayes have it, and the meeting minutes are approved. And we'll kick off now for our next item with a presentation from the Alliance to End Homelessness.
Cool.
And we are pulling it up.
Yeah.
And we'll add, Renee to the,
Great.
Well, thank you for inviting me to be here for this presentation. My name is Katie Egan. I use she, her pronouns, and I'm the Continuum of Care Planning Director at the Alliance to End Homelessness in suburban Cook County. And we are the lead agency, the HUD designated lead agency for the suburban Cook Continuum of Care. We are one of 19 Continuum of Care in the state of Illinois. And so I'm going to do an overview of what does that mean? What is our role of the Continuum of Care, and what does it mean for us to lead the homeless response system in suburban Cook County? So I'm going to look at my slides here, and Jessica's got them up for you here too. Perfect. So first I'll start off with a snapshot. Some of you may be familiar with this. It's called the point-in-time count. All Continuum of Care across the nation. I mentioned we're one of 19 in Illinois. There's 600 plus in the nation. Everyone is required to do a census to get a snapshot of a point in time of how many people are experiencing homelessness. And so our 2024 numbers will be finalized by the end of this month. So this is last year's final numbers, but on any given night, there are 1,056 people experiencing homelessness. The majority of those, last year was 984, were in shelter or transitional housing specifically dedicated for people who are experiencing homelessness and have nowhere else to go. And at least 72 people were outside. I say at least because this census takes place overnight. We go out between 8 p.m. and 1 in the morning and try to identify folks who are staying outside. And we know that this isn't capturing everybody, but this is 72 people were encountered overnight on one night.
Suburban Cook County, like Cook County.
Yeah, just suburban.
Just suburban Cook County, yeah. So the next slide, so our specific geographic region is all 130 suburbs outside the city of Chicago. So that's a massive region. It's home to 2.5 million people, 30 townships, 130 suburbs. And so how we organize that is through what we call community-based service areas. We have one in the north suburbs, one in the west, one in the south. The North, West, and South each have their own councils. We call them the West Suburban Council on Homelessness, South Suburban Council on Homelessness. In the North, it's called the Association of Homeless Advocates in the North District. But everyone picked their own name. But it's a collection of grassroots organizations that get together monthly, and they are form the base of our homeless response system. We, as the leader of the Continuum of Care, are tasked with leading the homeless response system, and we believe that is possible. We believe that ending homelessness is possible through cross-sector collaboration, data-driven decision-making, and removing barriers to housing. And so what does that look like? So again, as the lead of the Continuum of Care, it's intentionally a diverse network of partners who are coming together to develop, fund, and implement solutions to end homelessness. The large majority of our member base are homeless service providers, the folks who are doing the frontline day-to-day work of providing homeless prevention, emergency shelters, street outreach, different crisis interventions for people experiencing homelessness. But we also work very closely with local, state, and federal government, particularly HUD, particularly IDHS, particularly Cook County, those government entities that are responsible for administering public funds specific to homelessness. And then we also work closely with policy and advocacy organizations to remove those barriers to housing at a legislative and budget level.
I'm sorry.
Yeah.
I saw suburban Cook County, and now this just says Cook County, so I just want to make sure I'm...
Yeah, our technical name, if you look it up on HUD, is the Cook County Continuum of Care, but our geographic region is just 130 suburbs. Yeah.
And the Chicago one is Chicago, right?
That's correct, yes. So, we're one of 19, like I said, so Chicago has a Chicago Continuum of Care. We cover just the suburbs. There's a DuPage Continuum of Care, Will County. In southern Illinois, there's an 18-county collaborative, so.
19 in the state.
Exactly, there's 19 Continuum of Care in the state, and each of those 19 have their own assigned geography from HUD. Yeah. And so that kind of gets, these next three slides are kind of our three pillars of what we do as the lead for the Continuum of Care. And the first is planning, Continuum of Care planning. And this is really our origin story, why we were founded, is because each of these continuum of care, like I mentioned, are responsible for submitting an annual application to HUD for funding. The Continuum of Care program is the largest federal program providing funding for homelessness services and housing assistance. And each Continuum of Care is responsible for coordinating the annual application to HUD. So that is one of our primary tasks. And we are awarded approximately $24 million annually from HUD. That goes to 45 unique projects across suburban Cook County, all of which are specific to housing programs. There's two primary homeless assistance grant funds. One is the Continuum of Care program, one is the Emergency Solutions Grant program, which I think is sometimes discussed here too, but those are two separate homeless assistance grants. Continuum of Care funds are specific to the housing interventions. Emergency Solutions Grant is specific to street outreach, shelter, homeless prevention, and some short-term rental assistance. We partner with county government, state government, like I said, for other public funding that's available and specifically dedicated for people experiencing homelessness. And then also a big part of our mission is that advocacy, again, for budget and legislative policies. Then another pillar of our work is coordinated entry. So as part of the Continuum of Care program across the nation, every Continuum of Care is tasked with coming up with their regional system for how they standardize and expedite how people get connected with HUD-funded housing. And when I say HUD-funded, I'm specifically just talking about the Continuum of Care program. Each Continuum of Care operates a regional system where they come up with standards of how people are prioritized in alignment with HUD regulations of how the Continuum of Care funds are intended to be used. And so this is what allows our region to better target those Continuum of Care resources to the people who are most in need and connect people with the intervention that meets their preferences and their needs.
Katie, if I could just also jump
Yeah.
in and say, even though Evanston's ESG wasn't mentioned, Katie didn't mention it specifically, Evanston does follow all of the coordinated entry requirements. We're in line with the Alliance, in terms of all policies and procedures
Yeah.
for matching, with funds.
Absolutely, and how HUD views that is they call it homeless assistance grants, and there's two streams of that, Continuum of Care and Emergency Solutions Grant, and all are governed by the requirement for coordinated entry. There are 9 local governments across the state of Illinois that receive their own Emergency Solutions Grant funds. Evanston is one, Cicero is one, and Cook County is one, as well as some other places across the state. But, yeah. And then, again, coordinated entry it's supposed to better match folks with the resources that meet their preferences and needs, and part of how we do that is having a handful of access points. One being our call center, so that regardless of where you are in suburban Cook County, you can call a number, and they have real-time data of what resources and referrals are available across the region. And then we also have street outreach staff who are meeting folks where they're at outside, drop-in centers that provide set times during the day for people to be able to come in, and then emergency shelter, all of those being access. And then the third pillar is the homeless management information system. And so this is also something that all lead agencies for Continuum of Care are tasked with.
I'm sorry, before you go on.
Yeah.
Y'all have a shelter that you manage?
No, we ourselves as the Alliance do not provide any direct services. We are the,
But the street outreach team is Alliance Outreach, or is that, are they
No.
employed by your partner?
they're employed by our
Okay,
partners,
all right.
exactly.
Well, and if I could also say, Councilmember Ritz, you didn't know we would be doing this in tandem. Here we
That's
go.
okay, yeah.
One of the main goals of coordinated entry was really to, help people who were using the services not feel like they have to go from one provider to
Yeah.
another.
Right, right.
To, like, maybe get a better place in line, or to try and get different resources. So it really was to standardize the process and to make sure that, like, everyone in that continuum was counted and matched with the resources that they need in a way that was
Right.
suitable.
That's exactly right,
Yeah.
yeah.
No, I was trying to see which, I just wanted to know which of these 3 or 4 things is like directly managed by the Alliance versus partner organization. So the call center is managed by the Alliance, right, or no?
The call center is not managed by the Alliance, no. So, we are providing the strategic planning and oversight, but all of these direct service are managed by partners. So currently, the call center is managed by Catholic Charities. That will transition. We're in the process of identifying a new host for
What
that.
about the website?
The website's managed by me, yeah.
All right, perfect.
Yeah. And then this next pillar, the homeless management information system, oh, no worries, there we go. This is managed by a team at the Alliance. And so we are the lead agency for, both suburban Cook County and the DuPage Continuum of Care. The HMIS is a secure online database. It allows member organizations to collect client-level data. And then we also use that, our team, how they manage it is they do all the database management, privacy, consent, and then also system-wide reporting, because we report, regularly and often to HUD, to the states, provide information for City of Evanston, other municipalities, philanthropic community. This is the database that we use to track client-level data and report it out at an aggregate level. And then using data to measure our performance and inform decision-making is core to our values.
And all of the providers we fund for homelessness services are required to enter people into HMIS. So not just connections, but also interfaith action, impact behavioral health. The only exemption is the YWCA, but that's because they provide domestic violence services and they have a separate system.
Right, and that's actually something new that we just started 2 years ago, where all of our VSPs, victim service providers, who fall under even stricter privacy and consent, we have a separate HMIS implementation that meets all of those federal requirements. And so YWCA reports to that as well. So in general, when we talk about our homeless response system, we are talking about meeting folks where they are at in their crisis. And so at the first step of this, it is eviction prevention, homelessness prevention, having folks keep the housing they already have whenever possible. We have then homelessness diversion, which is when someone is at risk of needing shelter, of having no other place to go. How do we have a problem-solving, housing-focused conversation with them to see what are the alternatives instead of shelter? Is there other family or friends? Is there conflict mediation we can do between you and a family member who you're staying with? How do we prevent you from losing the housing that you have whenever possible? And then we know that that's not always possible, so we need emergency shelter and crisis housing for people who have nowhere else to go. But then the solution to homelessness at the end of our system and our biggest focus is how do we connect people with affordable housing, with the services they need to be able to thrive. So how do we provide that rental assistance, the supportive services, whatever they need to have their own housing ongoing. And that can take multiple different forms. And we're gonna talk about some of the homeless interventions that are provided, but this could be finding affordable housing that you can afford yourself without a subsidy. This could be housing with a subsidy. This could be any of the interventions that we have. So not just continuum of care funded, but how do people get connected with safe and stable housing? So then oftentimes when we're talking about the different interventions that are provided, and I'm going to go through that in more detail, we talk about them through the lens of the HUD definition, and that's because, again, the Continuum of Care program is the largest federal program for homelessness services, and so these are the definitions that's used in terms of the funding eligibility. So when we're talking about literal homelessness, it means that it is someone who is staying in a shelter that's designated for people experiencing homelessness, or in a place that's not meant for habitation. They're staying in their car, a park, CTA, whatever it might be. They have no other safe and stable housing to go to. When we talk about chronic homelessness, this is for someone who is literally homeless. They meet that unsheltered or sheltered definition and have either been staying outside or in a shelter for a year or longer and have a chronic disabling condition. And chronic disabling condition could include a physical disability, mental health diagnosis, substance use, some kind of disabling condition that prevents them from either being able to afford housing, working, something that stands in the way. That's a barrier to them being able to find housing. When we talk about imminent risk of homelessness, so this is that front end, that homelessness prevention, it's someone who's at risk of losing their housing within the next 2 weeks. This is usually an eviction notice. Or they've been staying with someone regularly, family or friends, and there's some kind of conflict, or there's some kind of reason where they have to move out. They're imminently at losing their housing in the next 2 weeks or so. And then also anyone who is fleeing or attempting to flee domestic violence. This is kind of all-encompassing in terms of dating violence, sexual assault, any kind of physical harm to them or members of their household, and they do not have another place to go. So then, kind of along with those circles that I showed with the homeless response, I'm going to walk through these 6 very specific types of interventions that are provided by our member agencies across the continuum of care. We'll start with prevention. And actually, if you just want to move to the next one, yeah. So the population that's served with homelessness prevention is those who are at imminent risk of homelessness. So they already have housing, they already have a place where they're staying, but they're at risk of losing it. How folks get access to those prevention services is through the call center. So this gets exactly at what Jessica was saying. Instead of having to call 15 different providers, you call the call center, who has a real-time understanding of what referrals are available and what resources are available across suburban Cook County. So when you call the call center, it's a standardized assessment to determine someone's risk of homelessness and housing needs. That gets reported into a homeless management information system. Then there's a referral to one of 15 different, what we call portal agencies across suburban Cook that then process the applications for the homeless prevention assistance. And then that household works directly with the case management staff at the agency to determine which source of prevention funding best meets their needs. For the most part, the largest source of funding for this comes from the state of Illinois, from the Department of Human Services. And then homeless prevention assistance is sent directly to a landlord. Then for homelessness diversion, this is someone who is really at the brink, who we talk about being kind of at the front door of shelter. They have nowhere else to go. They're in crisis. Either it's tonight or tomorrow or the next day, but they're going to need someplace to go. The call center is still the primary access point for that. However, through street outreach staff or through walk-in centers, that might be also where we meet folks where they're at here. Again, it's a standard list of questions to determine what's your crisis and what are your needs, then a referral to one of the 9 agencies across suburban Cook County that provide diversion services, and then the household is working directly with the diversion staff at that agency to have that housing-focused, problem-solving conversation to identify alternatives. We find that about 35 to 40% of the time, there is an alternative, that there is somewhere else that someone can go, someone else someone can stay with. Oftentimes this ebbs and flows, but sometimes there are flexible pots of funds. So if someone says, I have a sister in Milwaukee and I want to go stay with her, that would be a safe and stable place for me to go. That flexible pot of funds can be used to buy a train ticket, for example. That's one of the most common alternatives of a family member or a friend, where it's someplace where someone can go. The staff member calls that family member or friend and says, hey, I'm here with so-and-so. This is something that they've identified would be a great solution for their crisis. Are you on board with this? And then the train ticket or the plane ticket or whatever it might be is purchased. Or there might be other things, conflict mediation. But about 35 to 40% of the time. It's not intended to screen people away from shelter, because if people need shelter, if people have nowhere else to go, then they need shelter. But it is a recognition of oftentimes when folks are in crisis, having a designated counselor to talk through possible solutions, that there is often a solution that's not shelter, that doesn't have to be shelter. Yeah.
Can I ask a quick question about the prevention?
Yeah.
What's a typical award? You said they work directly with the landlord, but what would be a typical
Yeah.
or common?
Yeah, so with the, IDHS Homeless Prevention Funds, which is the primary source of funds, that can go up to 6 months backwards in terms of arrearages.
Yeah.
The most common situation there is someone was laid off or had to take time off of work to care for a family member or had a fire or some kind of temporary crisis, and fell behind on rent. One of the criteria for this is that you do have a way to pay your rent going forward, because it is one-time assistance.
Yeah.
But if we pay your back rent, are you able to pay it going
Okay.
forward? Or maybe you have been evicted, but you have found a unit that you can afford going forward, so this pays your security deposit.
Gotcha.
But a standard award is typically between maybe 3 to 4 months of back rent.
Okay, great.
I'm sorry, could I say, this is where Evanston ESG prevention varies just a little bit,
Yeah.
so like yours. So we can pay up to 6 months of arrears in terms of rent and utilities. We also have the ability to pay going forward. The subsidy would never exceed 24 months, including arrears within a 36-month period. Those are ESG regulations. And what we try to do is prevent the eviction. So if somebody falls out of their rent and they need arrearages and they're 2 months away from their lease ending, chances are we'll extend the support for 2 months. And when I say we, what I really mean is the Connections case managers who are working very closely with the households. But there is, one of the nice things about prevention is that if we can keep, if Connections and the case managers working with households can keep people from being evicted, that's one of our goals.
Yeah, and that more expansive definition of ESG is really helpful, because the majority of these funds, like I said, are through IDHS, Homeless Prevention, which is governed by different rules than ESG. But yeah, being able to go backward and forward is really helpful, where for the primary source of funds for these 15 agencies is mostly just going backwards. Okay, and then street outreach. So then this is for folks who are staying outside, who are staying, in their car, at a metro station, abandoned building, and the entry point for them is street outreach staff. And so we have, 7 agencies across suburban Cook County that have designated street outreach staff. It's not nearly enough. That's part of our advocacy, is that there is no designated source of funding from the state, for street outreach staff, which is so critical to be able to build that trust and consistency with folks who are staying outside. But there's about 7 agencies across the suburbs who directly employ street outreach staff. And so that's what I have here. They canvass the region, build partnerships with Forest Preserve, Emergency Room. We have a new partnership with Metro that we're really excited about. Metro just established an internal committee to do better than just having Metro captains arrest people who are staying in stations. And so we're really excited about that work with Metro that we've been doing. What we do have at the Alliance is a staff member who works directly with all of those street outreach folks. So that's my colleague Janaea. She's our Outreach and Lived Experience Engagement Manager. She brings together street outreach staff each month, does trainings on best practices, helps with data quality management. In addition, she leads our lived experience engagement. But yeah, street outreach staff really are there to build trust, provide basic need items, and then to get folks inside whenever possible.
Connections does employ a street outreach, a portion of our ESG, about 34,000 goes to street outreach.
So then the next is shelter, and so again, this is for folks who have nowhere else to go, so we would, HUD would define that as literally homeless. The entry point into shelter is through either street outreach staff or through diversion, that diversion conversation. If someone's not able to be diverted, then the outcome is they need shelter, and so then that's how they would get connected to shelter. I imagine it's come up here, but it's true across suburban Cook County as well as across the state that most shelters are at capacity. We do not have enough shelter for everyone who needs it. And when we talk about shelter, there are multiple modalities of shelter. So when we think about what our vision for crisis shelter is across suburban Cook County, we think about it in these 4 different categories. The first is transitional housing. This is oftentimes an apartment that is leased by an agency. They have a master lease of apartments, they're furnished. They work really well for larger families, for people fleeing domestic violence. People can move into that apartment, and then stabilize, and then go from there, try to find other housing. Then we have our hotel-based crisis housing. So this was, because prior to the pandemic, 70% of our system was a PADS-based model, meaning that it was rotating churches different nights of the week. It operated seasonally from September to May in alignment with the school system. There was very limited shelter during the summer. It was primarily volunteer run. That was about 400 beds of shelter before the pandemic. And then the pandemic hit and that was gone. And so we had to transition to hotels immediately. And so, this is across all of suburban Cook County. We have been braiding together emergency pandemic funds for the last 4 years to make that work. But we went from about 350 to 400 people in that PADS model to about 600 to 700 people in hotels on any given night. And then that has transformed into how do we operate non-congregate shelters? So people with their own individual rooms, 24/7 services on site. How do we use the pandemic funding to invest in capital so that we can do that? Because we know that this is a more trauma-informed model than what we were doing before, of different churches, different nights, people only being able to stay from 7 p.m. to 7 a.m. That still operates, and there's still absolutely a role for that, which is this next modality, this rotating shelter. We still need that. We still need to be able to give someone an address and say, if you go to this church tonight, you will have a meal and a place to stay. And that is absolutely still needed as a low barrier access to shelter. And we do have 2 different PADS-based shelters operating, but that is still definitely part of our vision of shelter. And then medical respite, which is when people are in emergency rooms, don't have any housing to go to be, what's the word I'm looking for? Discharged, thank you. To be discharged from, how do we have dedicated crisis shelter beds that also have medical staff on hand that can help people, especially things like wound care, frostbite in the winter, things where a standard shelter setting without more intensive medical care wouldn't be a good thing.
And a portion of, the special services grants goes to interfaith action that is on that PAD system, does provide shelter.
Yeah. Okay, so then, these next 2 are our primary types of housing intervention. So when I was talking about the Continuum of Care program and funds from HUD, these are the 2 interventions that can be funded by those funds. And so rapid rehousing, still, the population is for people who are literally homeless. You have to be in shelter or be outside, to be eligible for this intervention. Folks are identified for this through street outreach or through emergency shelter. And then what's done is, so as folks are there, they're doing a housing assessment, which means that they've been intaked into the program, they've answered questions about themselves, where would they like to be housed, where's work, where's family, what community do you want to be in? So that's kind of what we mean by the assessment. And then in terms of how folks are prioritized for housing, it's based on how long they have been homeless. So they have to both be literally homeless, and then how long have they been homeless. And then once they are matched with a vacancy for rapid rehousing, then it's the agency and the household are looking for a unit out in the community. Then the lease is put in the household's name, and then they can receive rental assistance for up to 24 months while they're receiving case management services that provide progressive engagement, with the goal of someone being able to sustain that lease on their own after that rental assistance is done. And then permanent supportive housing, this is about, 70% of that 24 million that I mentioned earlier in continuum of care funds, about 70% go to permanent supportive housing. This is for chronically homeless individuals, so someone who has been homeless for a year or longer and has a chronic disabling condition, who we see as the most vulnerable, and the most in need for long-term ongoing assistance. Again, folks are access this through either their interaction with a street outreach staff person, because they're staying outside, or an emergency shelter. Same as what I mentioned before, there's that housing assessment of how long have you been homeless, other intake data, where would you be interested in housing, and then as vacancies become available, then we match those who have been homeless the longest with a vacancy, and they work collectively with their agency to identify a unit out in the community. Probably 85 to 90% of permanent supportive housing is just private landlords that take vouchers or work with our programs. So it's just finding units on the marketplace like anybody else. But finding that unit, but then the lease is in the agency's name. And then it's ongoing rental assistance with no time limit, and then the intensive case management services to make sure that folks have what they need to maintain that housing. So that's what I've got, yeah. Questions, other things that would be helpful. I appreciate you, kind of putting some context into it too, of what does that mean locally, but, this is our homeless response system for all suburban.
Yeah, so if this is in response to our discussion at the last meeting, or so Connections was brought up.
Okay.
And so how does Connections fit into?
Yeah, so we have 40-plus member agencies, of which Connections is one of the member agencies. And so those 6 housing interventions that I mentioned are provided by member agencies. Some member agencies provide all 6. Some provide one of those interventions, some provide a couple. But Connections provides all 6 of those housing interventions.
That's their only role within all of this.
Yeah, well, I mean, tell me more what you mean by that, because so we're kind of the umbrella, we bring together all of the individual nonprofits across all the suburbs who are providing these direct services, create this shared vision and understanding of what does it mean that we're ending homelessness. So, yeah, so they are one of
And it was
40
really,
plus
I think,
member agencies.
Renee that brought up a few points last meeting, and I think this speaks to it, unless it doesn't. I just wanted to, I'm trying to draw back in that discussion so we can continue now that we have this information, yeah.
And Katie wasn't there, so
I wasn't, yeah.
Right, and so
Mhm.
I would have to, Renee probably could explain it better than I did, because I brought up the couple points about Connection.
I actually don't have any questions about it,
Okay.
but what I was trying to explain I don't need to explain how Connection ties in, how they receive, the clients, number one, because I think they're a receiving agency, right? And then after that, what happens after they receive the client? What happens then?
Yeah, so that gets at, actually, if you move to permanent supportive housing, that would be a good, example here. So, there are, like I mentioned with our continuum of care grants, we have 45 grants, and, 32 of them are permanent supportive housing programs. So those are all considered receiving agencies. So that means that they receive funds from HUD to have a set number of permanent supportive housing units. When one of those units becomes available, they submit a vacancy, request. And then what that means is our by name list, so this is folks who have been homeless for 12 months or longer, have a disabling condition. Whoever has been homeless the longest is then matched to that vacancy. So that, could be at any of those, 32 permanent supportive housing projects across the county, of which Connections has 2 permanent supportive housing projects.
And is it matched, I assume, on the assessment, location, and?
Exactly,
Okay.
yeah, so it would be whoever has been homeless the longest and who has indicated that they're interested in living in the north suburbs.
By projects, you mean units or buildings or what?
Well, each project has different amounts of units,
The sites, like buildings, actually?
no, I would say probably 90% is scattered site, meaning it's finding private landlords within the community who are willing to work with the agency and the client. And then that lease, signing that lease in the agency's name.
Well, when you said 32, is that 32 units?
No, that's 32 individual grants, and within each of those grants, they have different unit amounts. I would say that most have between 15 to 30 units, probably.
You know roughly how many permanent supportive housing units we have within suburban Cook?
Yes, we have about 1,000 permanent supportive housing units within suburban Cook.
And you don't happen to know the north?
North specifically,
That's okay.
I think is about 30% of, yeah.
Okay,
I think it's about
so it's about-
30%, yeah, yeah. And that would be, yeah, I'm looking at the numbers a lot, yeah. But that would be, Connections, Catholic Charities, Impact Behavioral Health, the Y for DV specific housing for sure, I'm forgetting, some Center of Concern.
Those are receiving agencies?
Yes, exactly, meaning that they receive HUD funds to pay the rental assistance for a permanent supportive housing unit, and then, once those turn over, because part of it is they're at capacity, so to
Right,
have a vacancy, it means that someone has moved out.
right.
I mean, that's it, it means that someone has moved out of one of their units, so then, either because they have moved into a nursing home, or have moved in with other family members, or, have moved out of state, whatever it might be. So, I would say that it's probably 10 to 20 vacancies a month in terms of turnover. Because it's
Is that-
permanent, yeah.
Is that 10 to 20 full Cook?
Yes,
Or
yeah,
just suburban Cook?
yeah, full
Perfect,
suburban
okay.
Cook, yeah.
So not many.
Right, and because there is no time limit on this, because again, this intervention is dedicated to the people
Who are most vulnerable.
who are most vulnerable.
Do you help me understand the project again? I'm still caught up on that.
Yeah.
32 projects, so it's like each, is Connections at one of those projects, or? I'm
Yeah,
trying-
Connections has 2 of those projects.
2 of those
Mhm.
projects?
Yep, one is, individual permanent supportive housing and family permanent supportive housing.
Okay.
And like Catholic Charities, for example, has 3 separate permanent supportive housing projects, and, Impact Behavioral Health has 2 different permanent, but essentially, when I
So
say
under
that,
permanent supportive housing,
Yeah.
there's 32 projects?
That's right.
Okay.
that's right.
Thank you.
And
Hanging in there.
each project, represents a grant from HUD.
Okay.
Complicated.
Yeah, and permanent supportive housing is a term that's used, broadly too, not just for the homelessness community. It's used, for the, developmental disability community, or, I think that's probably the only other community that uses it more broadly. But when I'm talking about permanent supportive housing here, it is just the HUD Continuum of Care funded permanent supportive housing.
Can you explain to all of us, well, I know, but some people may not know what project means.
Yeah.
Project.
Yeah, so again, it means a grant. So it means a 12-month grant award from HUD that has specific dollars for rental assistance and case management services. That grant is managed between HUD and the nonprofit agency. When I talked at the front about our origin story, my job is to coordinate all of those grants every year to submit to HUD as a collective. So the 32 individual grants for permanent supportive housing, range from 15 to 30-ish units, sometimes more. But essentially, it just means HUD designated funding that goes to pay the rental assistance, and pay the staff for the case management services. Yeah.
So are those grants awarded only on a 12-month basis?
That's right, yeah, so it is a lot of turnover.
If there's a delay in setting the federal budget, those grants are delayed?
Well, luckily, we don't face that as much. They still, there's always the risk if they don't set the budget, but because they set it far enough in advance and because the competition is timed, so for example, this September, we will apply for the funds that will begin in 2025, and so that,
I see. And at the beginning, of the presentation,
Yeah.
you said there's something like 1,056 homeless people,
yeah.
a night average. does that fluctuate much during the year? Does it ever go lower?
Yeah, it does fluctuate. When we do the point in time count, just like all the other communities across the country, HUD requires that it be done at the end of January. So if you are finding people staying outside in Chicago in January, they are truly the most vulnerable. Because we do see folks staying outside, tend to increase during the summer months. That maybe they can find family or friends to stay with during the winter months, but they are staying outside in the summer months. And that's just a snapshot,
Right.
of on one night.
And you said 12 months, does that mean there's vacancies after every 12-month period at least?
No, ongoing, because as folks are moving out of those units for whatever reason, that's when the vacancy. But it's the 12-month grant agreement with HUD, so they only renew funding every 12 months.
Okay.
Mhm.
And this is just for homelessness, this isn't for housing insecure, right?
Exactly, yeah, this is just for homelessness. Mhm.
If it would be helpful to the committee, Katie, I'm so impressed with your knowledge, that you're able to just pull off the top of your head. But if there's an appetite in the committee, I'd be happy to bring back more numbers from the point-in-time count, for the different projects and the agencies that manage those projects and the number of beds that we have dedicated to
Yeah, and
supportive housing emergency.
yeah, I mentioned this at the very top, but this year's numbers will be finalized by the end of this month. So in addition to the point in time count, we also do something called the housing inventory count, which is every homelessness dedicated bed across suburban county. And so those numbers will be finalized by the end of this month. So I'd be happy to share them when those are ready.
Cool, because
And-
now, yeah.
Now we're curious.
Yeah.
So what's the relative need when you look to the north, to the west, to the south? Is clustered more, I mean, the need?
Yeah.
The response and.
Yeah, and so, I mean, one of,
Some idea of that, like.
yeah, one of the ways we look at that is through call center data, how many people are calling because they need that homeless prevention assistance. About 65% of those calls come from the south suburbs. And then it's hard to track need by shelter beds because all shelter beds are at 100% utilization. So that's not an indicator of need, it's an indicator of how many shelter beds are available.
Right.
Yeah, yeah.
I think a follow-up for that
Yeah.
would be helpful, I think, for us in the community, is to know how close are we meeting the need?
Yeah.
In our area, in the north side, right? You know,
Right.
What's there?
Yeah,
The need that's also there, it just would be great to.
right. Part of,
For me, it's more to understand frankly, the severity of the issue.
yeah,
And about, what can we do? Address.
right.
Can you disaggregate the data so we know what is going on in Evanston?
Well, so the what's going on is that, what are the housing crises? Is it in terms of people who are at risk of losing their housing, which is a much larger group? Is it how many people are being turned away from shelter on any given night, which is an indicator of like who's showing up, but there's no shelter bed available? So it's, yeah, but by housing crises, we can definitely have approximations. But when we brought in a consultant in 2021, when we did this big shift in terms of how we provide shelter, we looked at how many people are entering the system, how long are they staying in shelter, how long does it take for them to get to permanent housing, and so we estimated the right number of shelter beds is about 630 shelter beds. And we are not there. That is the target, and we know that will fluctuate, because if there's not enough affordable housing, people are gonna stay in shelter for a long time.
Right.
And that's not the final destination. The final destination is their own safe, stable housing. So long as we don't have enough affordable housing or permanent supportive housing or rapid rehousing, we're not gonna have turnover in shelters, which means that we can have an overly inflated shelter bed number when that's not the primary intervention. It's a needed and life-saving intervention.
They're connected issues.
Absolutely. And that gets back to the, if you go back to my circles, to why when we talk about our homeless response system, it is a full continuum of, we try we have to be really good at preventing homelessness and diverting people, that 35 to 40% of the time that I said, of finding other alternatives. And then we need to make sure that no person has to stay outside and no person is turned away from shelter, but then that safe and stable housing is the solution to homelessness.
When you say 6:30, that's across the whole suburban
That's
county?
right, that's right.
And where are you at now? Where are you?
We have made a lot of improvements. We did a lot of advocacy last year to the state of Illinois through, the Home Illinois, and so through the Emergency and Transitional Housing Grant, we were able to fund about 530 shelter beds, so we probably need somewhere, and when I say beds, I'm including families, you know, a unit that can accommodate a larger family, so it's less units, but more beds.
Yeah.
But we're making substantial progress.
About at 6:30, you're saying we're at 500 and something, is that what you're saying?
Yeah, probably around 550 or so. Getting there.
Mm.
Now, does that rely on, COVID response dollars that are drying up?
In part of the big advocacy last year to the state was because we hit that cliff. That cliff was imminent, and so the state stepped up in a big way. Prior to that, suburban Cook County received $600,000 a year for shelter, across all 130 suburbs. After that, we now receive closer to $8 million, and that goes to 12 different organizations providing shelter. So that's a substantial improvement.
And how'd you come up with 6:30, and then what? That means,
Yeah, so that was from, looking at all of that homeless management information system of how many people are entering our system, how long are they staying, you know, how many shelter beds, how quickly are they exiting? So it was a consultant who came in and, looked at our.
and I'm saying, what does it mean? If we get to 630
Oh.
beds, then that means we have, like, what is the?
Then ideally, that means no one's turned away from shelter. That means
Right.
that anyone who needs shelter has a bed to stay. Yeah,
That
but we
seems like
maintain that by having,
achievable.
yeah, absolutely.
Yeah.
Absolutely. But then the biggest piece is then having housing for people to move into from shelter.
Yeah,
Mm.
yeah.
Go right ahead, Jeff.
No,
You can't break that down by like small northern municipality by chance, can you?
The only reason why I can't is homelessness has no
Doesn't,
borders.
Right,
Yeah.
exactly.
Yeah, yeah.
Exactly.
Yeah, it's very fluid. If you're in crisis, you're gonna go to,
Yep.
you know, family and friends for a little while or whatever it might be, especially between Chicago and suburbs. Every situation is different, obviously. We see more people staying in their cars in the suburbs, than, you know, you might see in the city. So if you're in your car, you're gonna be traveling to wherever you feel like you can safely park that car.
and if I could just add, since starting with the city and being a part of coordinated entry meetings and seeing the Alliance's work and the COC's work in the community, when you said it's doable, Councilmember Burns, it is. Our COC reached functional zero homelessness for veterans
Yeah.
in
Well, we're very close. It's a very specific definition, and, what that means, functional zero, is that as veterans, as a street outreach person encounters a veteran or someone is identified, that they can be moved to permanent housing within 30 days. And we hover right there. But right now, I was actually just
It's
talking.
permanent housing, is that?
It's permanent housing. And I would say the biggest reason for that is something called a VASH voucher, which is similar to housing insurance voucher. 550 VASH vouchers in suburban Cook County. And if you remember, I said there's 1,000 permanent supportive housing. There are certainly a lot more people experiencing homelessness who are not veterans than are veterans. But that is a clear articulation of if people have affordable housing, that can end their experience of homelessness. So we have about 550 units of veteran-specific housing, and then we hover right at that line. When I was talking with, our board chair also works for Hines VA, and we were talking yesterday, and there are 10 veterans who are currently homeless in suburban Cook County. And all of them are known by name. Everyone has some kind of a plan or, is regularly engaging with someone until they're ready for a plan, but there are 10 veterans in suburban Cook County.
So what I'm dealing with is actually a resident now that has a VASH voucher, and
Yeah.
it seems like he could not find a unit in Evanston, almost as if the program won't operate in Evanston, only in Chicago? Does that make sense? Why he wouldn't be able to use it here in Evanston?
It's possible that maybe he got his VASH voucher from Chicago Housing Authority.
Okay.
'Cause CHA,
CHA.
kind of similar to when I was talking about our geographic boundaries, HAC, the Housing Authority of Cook County, is just for the suburbs, excluding Oak Park, Park Forest.
Yeah, but you can port vouchers too in some cases.
You can after a
If you
year.
not port a VAS voucher?
Yep, you have to be in the region where that voucher was issued for a year, and then you can port.
This gentleman has, so that's gonna be good news for him. So he can port it.
Great.
Most likely, if he has a VAS voucher, he's been living in Evanston for a year, he can port it.
Oh, he wants to go to Chicago?
He's in Evanston now, he wants to stay in Evanston under this voucher though.
Okay.
But they're trying to say he can only use it in Chicago. That's the news I got back. So he should be able to use it here in Evanston.
If he was
Port it.
here in Evanston to begin with, and it came from the Housing Authority of Cook County, yeah, you
But
should.
even if it came from CHA, he can port it, right?
Yeah, but I don't know how CHA would have allowed him to be in Evanston in the first place.
Okay.
Yeah.
I'll talk to you about that separately if you don't.
Sure,
Yeah.
yeah.
So how does the influx of, immigrants
Yeah.
that have been shipped here from,
Yeah.
how does that affect the homeless?
Really good question. So a lot of that has been concentrated in the city of Chicago,
Sure,
those 27 shelters.
But there's some in the,
Exactly, and the biggest thing there is through the state of Illinois, there was something called the Asylum Seeker Emergency Rental Assistance Program, which provided 3 to 6 months of rental assistance for anyone who was staying in one of those 27 shelters. A lot of those folks found units in the suburbs, and now those rental assistance dollars are coming to an end. So, like, and they haven't had work permits approved, or they
Right,
haven't been able to
right.
find employment, so
right,
that now then falls in the eviction prevention, category of how do we help folks keep that housing?
so you may see an increase in homelessness in this definition
Yeah.
now, starting to set in.
Yeah, and, there's 2 specific shelters that we're calling kind of hybrid shelters that are operating right now. One is in the southwest suburbs, kind of right on the border of Chicago and Oak Lawn. One just opened up last week in Fort Heights, but that is serving people who are recent arrivals. It's not the same as Chicago. There's not necessarily buses being dropped off there, but it's folks who have made their way to the suburbs, and are staying at that shelter, in addition to people who have been experiencing homelessness in the suburbs. And same in Fort Heights, there's a 40-bed shelter.
To hear about it, thank you.
Okay.
So Jessica, to your point, more information will be helpful. There was also a little moment where you said, you might be able to provide some more information on need, depending on what information we wanted, if it was how many people were turned away in Evanston, et cetera. But I would
Right.
say whatever you have for Evanston, I'd love to see it.
Right.
I think we all would love to see it.
Yeah.
Thank you.
And I think any averages in terms of wait list, dollar amount for the prevention funding,
Yeah.
any sort of, or all the information I think you guys use for state advocacy that's very effective, just sort of like some of that information.
Absolutely, yeah. Averages for wait lists are hard to calculate, because again, we're prioritizing
Yeah.
based on length of time. So if someone were identified who's been experiencing homelessness for 10 years, they'd likely be at the top of the list, you know, so, so that's sometimes hard to put a number to, but yeah, anything else that can help advocate for how many people are turned away from shelter, how many people are turned away from homelessness prevention assistance, because there's not enough.
All right,
Yeah, thanks so much, Katie.
Yeah.
thank you.
Yeah, absolutely.
And this actually dovetails nicely into our next
Perfect.
topic. Sharing, correct? No.
Oh, was there a question just before I
Oh, yeah,
back up? Maybe they got frozen or something on the screen?
Well, we are sorry, Ally, they were moving for us.
And I
We'll
can
send
send
the-
Ally the slides if she, yeah.
I was actually gonna ask,
Yeah.
I didn't wanna put you on the spot in the
Yeah.
meeting, but if we could post your presentation, so
For
that
sure.
could be posted.
And you have it, 'cause I emailed it to you, so yeah,
Yeah.
feel free to post.
Thank you.
Yeah.
So if I could, I want to be mindful of the time, but if I could just take up a moment to share a quick, procedure for getting more information, when we do have questions, because these questions are valuable. They're pertinent to our ongoing discussions. Feels that it would be important to document them, and then have a record of our response. So, it's a brief memo in the packet. Questions that are shared at meetings are great because we do record our meetings. But committee members should always feel free to email staff, with additional questions. Any questions that I wouldn't want to answer in meetings, thank you, Katie.
No, for the Housing Authority, but I can.
Or that would require a more detailed answer, I would love to be able to take those questions back to the agencies and agency representatives and either come back to the committee with a full response or invite a representative from the agency in question to come and give more information. We also can review the information that we collect in reports so that committee members have a very detailed understanding of the information we're collecting in reports. We also collect a lot of information through Zoom grants, through the application when agencies first apply. And I can put this I would be happy to send this information to committee members or add this to, the SSC website, but, agencies submit their audits and their Form 990 documents proving that they're a nonprofit, their nonprofit status. We collect the annual reports, strategic plans, prior year activity reports. We get biographies of key staff and demographic information for review. And I know that a lot of this stuff isn't forefront of our minds because it hangs in Zoom grants. I primarily have access to it. But all this is to say, there is a lot more behind the scenes. If people have questions about finances or audits or, what agencies, how they, prove use of city funds, staff would like to be very transparent in providing that information to the committee. So please either send requests to me so that I can provide a response, or we can include it, the response, in meetings moving forward. I think that's all I wanted to say on that topic.
We'll go to the next agenda item,
Yeah.
which is,
Our last order is,
The
just
calendar.
a revised, calendar. So we do anticipate getting a new BCC member in the very near future. I realized after talking to the clerk's office that perhaps during COVID, our BCC support and onboarding has not been as robust as it was in past years, and that once our new BCC member joins us, or our new SSC member joins us, it would be helpful to maybe just have a little refresher. And so I've added that for June, assuming we have our new SSC member, if that's possible. And I'm happy to take any other questions about any of the other meeting items going forward. This is not set in stone. I will always work with our chair and vice chair.
So this is not a change in schedule, it's the agenda item.
Right, and it's more like a revision because we've missed some meetings.
Gotcha.
Well,
because, it's also taking into account the renewal cycle that the committee
Yeah.
discussed at the last meeting.
meeting and the conversation has been taking place so that we provide an updated schedule.
And I think it helps from obviously it's committee members, but also, I think more importantly for like the public to sort of know generally what our timeline will be.
I also think something to consider, we've been trying this out a little bit on the, NWDB committee, but, one of the first things I noticed after I was elected was that there was a report that was provided a while ago by, I think it was the League of Women Voters, and one of the recommendations they had for committees was for them to have work plans. The city stopped following that a long time ago. You know, I think it can be a little unnerving because like this is a volunteer, committee and, but I've actually found, that it's helped to better structure meetings and provide a sense of kind of purpose and direction for the NWDB committee, because we know what we're trying to accomplish. And it's very clear, we've split up into work groups, and again, it's given us a real sense of purpose. I think it also can help with quorum, because people feel, like they know what they're moving towards. So I think if we could gently introduce something like that, it doesn't have to be all out, but just something that we feel we can manage, it might be helpful.
I like that.
I appreciate that, yeah, I will get in touch with Tammy and get her template.
There's a
yeah.
Know what
template?
other
I love a
people
template.
are doing, yeah.
Right.
Yeah, we can send over what we have, but I feel free, we're still trying to figure it out ourselves, so I would say whatever we think would work for this committee, we could do that. It doesn't have to be the same thing.
Wonderful.
Yeah.
I love it.
So I have a question, clarification, I guess, maybe mainly for myself. So we're at the end of the 2-year grant cycle, right, that we did. So where it says the November meeting renewal allocation process discussion, is that when we're gonna start getting new applications or applications from, I mean, it's an open application process this year?
So no, this is a great question. We originally were
Thank you, I thought it
going.
was.
I appreciate that. We were going to open applications for the 25, 26
Yeah.
grant years. And we had started to talk about priorities for funding. And we realized that we just weren't quite ready to maybe establish, we needed more information as a committee to establish priorities, and that in the months we have left in 24, we're gonna take a step back and review the way we are, look at our like key performance indicators, both under case management and safety net, and really think about what we're measuring and what we want our outcomes to be. Once we have those established, you're not off the hook. We're still gonna bring the priorities discussion back, but that can happen later in the year so that we're ready to open up the now 26, 27 application in 2025. So in the summer, late summer, early fall of next year, we will open up a new application process. And
So does that mean the current grantees will have another year extension?
yes,
If
yes.
you decide.
If we decide, I mean, in theory, we could say,
Yeah, I just
Yeah.
wanna make sure we're not like grantees, the recipients of this money, are not gonna wait around for a year while we decide.
No.
And part-
What are we gonna do?
Part
I'm
of
used to
that,
that in the foundation world, that's why.
Yeah.
part of that discussion was also what took place at the last meeting was the fact that, this is a little bit of a transition year where there's a lot of different plans going on, a lot of different needs assessment survey going on. There's the HUD consolidated plan, there's just a lot going on, plus the wraparound services effort that could potentially impact things.
Yeah.
So it just felt like
Yeah,
a
no,
challenging year to
So
redo
the
everything.
we you were talking about, this is your staff and you're figuring out the process.
oh,
Yeah, it's us.
We're
It's you guys.
providing suggestions.
Oh,
Yeah.
Did I miss that meeting?
yeah, you
Yeah.
weren't here.
Oh,
It was just last month.
it was last month, okay. That was the meeting, we didn't have a quorum, right?
We have quorum.
We had quorum,
Okay,
we didn't
I'm
have a
sorry,
quorum.
my mind is slipping. I know that there was one time that I was gonna come, but I got sick and
yeah,
I'm missing the month. It's okay, okay, so.
that was March.
So now I got it. No, this is
We
good.
had a late quorum.
Okay.
We had quorum. Yeah, for our April meeting.
Yeah, we have quorum.
Yeah,
So we will not go through a marathon 7-hour meeting like we did 2 years ago or something like that to try to,
But we thought of you, Ken.
thank you. That was quite an introduction to this.
Well, and not
I think
maybe
it was
the
my
best
second
introduction.
meeting. Holy mackerel.
To be a little kinder.
Well, I'm also thinking about this, anyway.
No, yeah.
Okay, thank you.
All right.
Thank you for, putting up.
And then we have another time for public comment, right? Is that,
Yeah, but I don't think,
did we not cover everything? Did I miss one?
We got everything.
yeah, thank you.
We got a thank you from Ally,
Yeah, Ally.
and I don't see any public comment in the room. All right. With that, I see a motion to adjourn, and we'll see you next month.
Thank you.
Thank you.